Hello, good afternoon. Welcome to another fresh breath episode of Tribal Clock. Yes, you heard me right. I just said fresh breath. And I'm certain you know why I said fresh breath episode. Today, our topic is about preserving our smile. We want to keep our bright smile on all the time. So today is dental health awareness. We'll be discussing, several questions and, getting answers to all questions that we might have. So my name is Seun Aluko, and I am your host of today's episode of Talk Health Talk. And this is Tribal Clock. In Tribal Clock, we have a vision to educate and encourage and empower every individual to live life at their best. We want you, everyone, including myself, to prosper and live life to best, to thrive, to go beyond just surviving, but to as well prosper in everything we lay our hands on. So the Talk Health Talk is for us to take a grip of our health. And today we'll be talking about dental health awareness. Most times people talk a lot about their physical health, they go to see the doctor. And then when we find out that just few people talk about their dental health. And today we want to discuss that. And so what are we going to be discussing today? We'll be discussing what exactly is dental health. Why should we take a hold of our dental health? When should we even do that? How should we go about that? And, who should we even trust to do that? Should we even ever try doing that at all? So WHO makes us understand that our dental health is an important indicator of our general physical health. Can you imagine that? So today, I know I don't have enough knowledge to be able to talk to you about this. So I have brought a very, very special guest whose field is on this and will be able to educate you and I. So our guest today is Dr. Adesina. Dr. Tunrayo Adesina is a graduate of dentistry from Obafemi Awolowo University in Nigeria. She's a consultant oral pathologist and a lecturer in oral pathology at OAU THC. That's Obafemi Awolowo University Teaching Hospital in Nigeria. So today we are blessed to have her in this seat. I don't want to call it hot seat, but in this welcoming seat. So Dr. Tunrayo, you're welcome.
Thank you very much, Dr. Seun Aluko, for having me. I am so glad to be here, and thank you to the audience who would be engaging us shortly.
Thank you. Thank you so much for coming. So you're welcome, everyone. We have some present questions that we will be discussing. And if you think you have a question as we go along, please feel free to put it in the chat box and we will go through that. There's a reason why we're doing this live. We want you to have that feel of consulting with your dentist without consulting with your dentist. You know what I mean? So put your questions in and we will go through them. So now let's just start and go straight to our topic for today. We most of the time use the word oral health and dental health interchangeably. So let's ask from the expert, is there a difference? Is it okay to use oral health and dental health? And what's the definition of oral health?
Okay, thank you, Dr. Aluko. When you talk about your oral health, you are referring to the health of your mouth generally. And you know that in the mouth, you have your teeth, you have your tongue, you have some salivary glands here and there. You also have maybe the mucosa for those of us who are a bit medically inclined. So when you talk about oral health, you are referring to the health of each of these structures and not just your teeth. So usually when you say dental health, more or less you are particularly referring to the teeth. But when you say oral health, it is all encompassing, all the structures that are inside the mouth and some parts of the face actually is what the oral health covers. But for people who are not medically or dentally inclined, whether you say oral health or dental health, so the dental professions will perfectly understand what you mean.
Thank you very much. You know, like I said in the introductory part, I said most people talk about physical health. They go to see the doctor when they have headache or they're pregnant or they have malaria or flu or things like that. So we find out that just a very, very low percentage of people talk about the health of their mouth and their teeth. So today, and that's why we're doing that today. So why will you say it is important to be talking? Why are we doing this? Why is it important for everyone to talk about and to take a hold of their oral health?
It's so important, really, for us to take a hold of our oral health. I know for most people, unless they have toothache, I mean, they don't really think much of their oral health. Most people that present are usually people that perhaps have had one or more episodes of toothache that they couldn't handle on their own. But our oral health is so important, such that, you know, the way that your eyes is like the light of your body, the way that, I mean, with your eyes, you see first before you start to do other things. So also is your oral health. It's been found out that actually most other diseases in the body, they will manifest inside your mouth. So because there's also, I mean, that possibility greatly exists. It's important for you to take care of your oral health so that if there are other things building up in your system, because they are likely to show first in your mouth, you are able to tackle such situations quickly and remedy it. But the other thing being that there are, I mean, diseases inside your mouth that some of the times may be life-threatening. For example, there are infections that, I mean, can affect your, I mean, the lower part of your jaw, under your chin, those areas to your neck. If, for example, anybody has that kind of infection, it's actually a life-threatening emergency that we have to intervene immediately. So you want to be sure that you don't have any of these diseases. And one of the things we must bear in mind is that, you know, some of these diseases take a long time before they manifest. So that's why it's important for you to take care of your oral health so that if anything crops up, you can easily nip it in the bud. And if there's anything going on within other organs in your body, because they can show in the mouth, you can take care of them early.
Wow, that's very, very good. Thank you so much. So Dr. Tunrayo just explained to us that our oral health is like the eye is to our body. It makes you, you know, if the eye is not functioning, the whole body is in darkness. So if your eye, I mean, your eye is what you can use to visualize what is going on in the body, so to say. So she explained that if something is wrong with your body, I mean, it can be detected from the mouth. And you will recall that when you go to see your physician in the hospital, he or she will look through your mouth because he's trying to get a hold of something. But if you visit your dentist regularly, that will be detected early. And then, you know, like in our own word, she said, you can nip it in the bud immediately rather than waiting for it to affect and damage a very, very sensitive organ in the body before you know about it. So thank you very much. That's very important. So CDC said that the oral health is defined as the health of the teeth, the gum, and the entire orofacial system that allows us to smile, speak, and chew. And when I saw that, I was like, wow. So your oral health is the health of everything you can think of in your mouth and in your face. And this allows you to smile, to chew, and to speak. You can imagine not being able to smile. You don't know how harmful it is not being able to smile until you are not able to smile. or not being able to chew until you're not able to chew. So that's why it's important for us to take charge of our, oral health, right, on time. Now, I'm going to ask you this, growing up, we've had different and diverse education, both formal education and informal education, about how to take care of our teeth, ranging from using ashes, growing up in Africa, using ashes to clean our teeth, or charcoal to clean our teeth, toothbrush, or all that. We've had different education. But now we're going to ask you as a professional, Dr. Tunrayo, how should we clean our teeth?
Thank you. So cleaning our teeth is so very important. I mean, like you have said, we have tried all kinds of things in the past. I mean, based on the knowledge that we have. Now, when you look at your teeth, of course, we know that for a tooth, you have the 3 layers, the enamel, the dentin, the pulp. The enamel is that whitish part that everybody sees outside when you smile. And that is the part that you are really brushing or cleaning. Now, we recommend that you will clean your teeth using your toothbrush and a medium texture toothbrush and fluoride containing toothpaste. Why are we saying a medium texture toothbrush? A medium texture toothbrush because it is that texture that is good for your tooth, that will not injure your gums. Because when you use a hard toothbrush anyway, basically what you are doing is that in your bid to want to scrub as much as you can scrub, and what you find out is that most people, the technique of brushing is wrong. You just brush in an horizontal pattern like that. You brush in an horizontal pattern, which is already a wrong technique. You apply too much force and you damage the gingiva. And when you damage the gingiva, or what we call gum, it can, of course, get inflamed, it can get infected, you can lose your tooth because that gum is actually a part of the supporting structure of the tooth that we refer to as the periodontium. Now you want to use fluoride-containing toothpaste. Why do we advocate for fluoride-containing toothpaste? Because the fluoride-containing toothpaste has an anti-cavity agent. It will not allow holes to form in your tooth normally. But where you consume those sugary foods, the refined sugars, as we describe it, refined sugars in the sense that they have already been broken down into glucose at the time you are taking it. They are not complex sugars that your digestive enzymes have to work on and break them anyway. They are refined sugars. They are things you find in your chocolates, in your lollipop, in candy, in all these sweets, fizzy drinks. They are there. So when those sugars fall on the surface of your tooth, the normal bacteria that you have in the mouth, they act on them, they produce acid that begins to dissolve that enamel, and then you have what we call a cavity or caries. So what your fluoride is doing is to be able to fight against that. And that is what it does each time that you brush your teeth and you allow that fluoride containing toothpaste to linger a little bit on the tooth before you spit it out. That is what it does. I know that in the past, of course, people, have used chewing stick, and some people still use it. But the issue with the chewing stick is that, you don't have the benefit of fluoride on it. Although I think that I might have read that you have some of these chewing sticks that are being manufactured, and probably the fluoride is being incorporated. I'm not very sure of that fact now. But the chewing stick only gives you mechanical cleansing. You don't have that benefit of the fluoride for those who have had to use it in the past. So while you are able to scrub your tooth and it looks clean, the fluoride effect is not there. So that means that when you go back to consume your sugary foods, the cavity will form. Unlike people that use fluoride-containing toothpaste to brush their teeth, so that that fluoride can act and prevent cavity formation, or when a cavity is already beginning to form, it will bring about a mineralization of the tooth, that the sugar and the acid that was formed by the bacteria acting on the sugar are produced to dissolve your tooth. So it will remineralize it. If when you take the sugary foods again, the refined sugar containing foods that we have already mentioned, it will begin to break down again, but your fluoride remineralizes it. The thing about the fluoride containing toothpaste is that the content of fluoride you have is so, it's just the right amount that will not cause, you any adverse effects. Even when you swallow it, yes, we do not recommend that you swallow it. We recommend that with a small child, especially children who are less than 6, their toothbrushing is supervised. But even if, the case of swallowing advertently, maybe if a couple of times, it still would not give you any adverse effect because the amount of the fluoride in that toothpaste is not, so much.
Wow, thank you so much. You've covered a whole lot and you've covered some of the questions I have here. One of them is somebody asking if using toothbrush is better than using soft brush. And you've just explained that a medium textured toothbrush is what is advocated for. And the reason why we campaign against using hard brushes is because it may damage your gums. So you may want to do away with that. And then you also talk about the use of chewing stick, which is another question I have here. The use of chewing stick, if I hear you correctly, you're saying that you're not totally saying no to chewing stick. If you're used to using your chewing stick, all well and good. Dr. Tunrayo just told us that it will help us with the mechanical part of cleaning of the teeth, which toothbrush also does with moving and all that. But it will not help with the chemical aspect of cleaning of our teeth, which our toothpaste with fluoride does. So if at all you're going to use your pako, that's chewing stick, we call it pako in some part of Nigeria. If you're going to use that, ensure that you also use your toothpaste and toothbrush afterwards. Thank you so much. That is so impacting. So now somebody said flossing my teeth causes my gum to bleed. Do I have to floss?
Yes, thank you. The requirement for flossing is for people who, for one reason or the other, the junctions of their teeth are tight. The teeth they have tight junctions, and you have food particles, especially things like pieces of meat or chicken, hanging in there. For the person that is flossing and is bleeding, one, either the technique of flossing is incorrect, so you will need to see the dentist to show you how to floss. Number two, it may mean that you actually have a form of gingivitis or gingival inflammation. So that is why, you bleed when you are flossing. Normally, when you floss using the correct technique, we don't expect it to bleed. But if it bleeds to the extent that you are concerned, then there may be some problems with your gingiva. Your gingiva may be inflamed, or even the whole periodontal support of your tooth may need to be checked by the dentist.
Thank you very much. So do you recommend electric toothbrush?
Yes, electric toothbrush has, its own indications for the people who we recommend, the electric toothbrushes for. Usually, electric toothbrushes are recommended for people who, for any reason, are unable to, control their hands. They don't have that manual dexterity where, I can take my toothbrush and, brush the anterior teeth up and down motion. Then I come to the posterior teeth or the teeth that are on my cheek side. And then if it's the upper one, I brush downwards and outwards. If it is the lower teeth, I brush upwards and outwards. So for people who cannot control their hand movements and be able to do that, we will usually recommend that electric toothbrush for them. Usually people that are disabled for any reason or have any form of handicap that does not allow that control that normal, regular people can have. But if you want to use the electric toothbrush, it's okay if you can afford it. If, what you do is to also use it occasionally. Maybe, you think you want, a better control, basically.
Thank you very much. And I hear you say how we should brush the corners of our teeth. Because I realize that most people feel comfortable brushing their anterior teeth because it's just easy. And you may neglect the corners of your teeth. So Dr. Tunrayo just told us that in doing that, if you're brushing the upper corner teeth, you should brush it downwards and outwards. It's like you're trying to mechanically push out any food residues that may be in between your teeth. And also, if you're brushing those ones in the lower aspect of the corners of your, dentures, you should brush those ones upwards and outwards. So thank you for teaching us that. I'm just going to say something about the fluoride containing toothpaste. You have seen, some commercials or some, talks online that are campaigning against the use of fluoride containing toothpaste because of the fear of the fluoride content in it. So the fear is that it shouldn't be swallowed because they're thinking about poison, fluoride poison. So I know you said something about it. Can you re-emphasize that?
Okay, thank you, Dr. Aluko. For, the fluoride in the toothpaste, like I said, the amounts are very minute. Actually, the quantity is not such as may, give side effects, even when you use the fluoride toothpaste for the rest of your life, actually. I know that some of those campaign, some of the times it may be like things like something close or akin to a smear campaign because the amount of fluoride there is not so much. I know the concern a bit, for people who live in high mountainous areas where, for example, you already have a lot of fluoride in the water, but it is not a common thing. So the amount of fluoride, and for such people, who don't consume, for most of us, we don't live in mountainous regions. And so we don't even take fluoridated water. And I know that it's on, recently, maybe like 4 or 5 years ago, that we started finding iodized salt. And even at that, it's not everybody that buys because it's packaged salt anyway. So the only source of fluoride that you would have is really from that toothpaste. And like I said earlier, the amount is too minute for it to even give you any side effects. And that's why we said that for children less than 6, their brushing with fluoridated toothpaste must be under supervision. But even if you swallow it at that, it is still too small. Even though we don't encourage anyone swallowing it, we expect you, when you are brought, to switch and spit out.
Thank you very much. So now, I know we talk about dental visits. We use the word dental visit for dental services, which is good. I think that word is used for a reason. I think it's to alleviate some of our fears because both young and old, we all have a form of fear going to the dentist. Like I said, Tunrayo, I would rather come to your house and eat eba and ogbono and visit you than come to see you at your clinic because, what's there to visit? But anyway, it is called visit for a reason. The dentists are trying to make it, bearable for all of us, make it friendly, make it, comfortable for us to come and so that they can check our teeth and we can take a hold. CDC said that 3.5 billion people has oral infections, oral diseases, 3.5 billion. I was like, wow. And there are so many people that has, something going on with either their teeth or their mouth that they're not aware of. So it is very important for us to visit, our dentist. Now, having said all that, How often should we visit dentists?
Thank you. So our recommendation is that you visit your dentist at least twice in a year. Like, I mean, we have mentioned in the discussion earlier, there are a number of things that show up in your mouth. I mean, to you, you are okay, but I can tell you that if you walk into any dental facility, when we look in your mouth, there are certain things we find. There are some processes that are always going on. For example, everybody will have a measure of gingival inflammation. I mean, you know, people that, try to chew bone, brisket bone, some people that chew on pin, I mean, as a deleterious habit. Some people also that may bite on, I mean, they use their teeth to open corkscrew. You find out that everybody that presents in the dental hospital has a measure of dental anomaly, quote and unquote. I mean, if you look at our faces, some people have small jaws. If you look at inside our mouth, some people have some funny arrangements of their teeth. So everybody really has to visit the dentist because of all of these things. Of course, we know that dental awareness is beginning to increase, and you know the dentist and of course dental profession will try to make it as pleasant as possible. Why do we ask you to come at least twice in a year, every 6 months? We want you to come for what we call oral prophylaxis. We want you to come so that we examine your mouth, we examine your teeth, we look at your gingiva or your gums, we look at your tongue, because there are even diseases that affect only the tongue in the mouth. So we look at your tongue, we look at, you know, your throat. Some of the times we look at it and then we're able to certify that you are okay. Usually they will end up going for that oral prophylaxis or the scaling and polishing, because really no matter how hard you brush, when plaque is just like an oral biofilm, a film that just forms in your teeth. Even when you have just finished brushing, the plaque is forming when the food, the substances from your food and all that's joined with it, it can become mineralized. All the calcium that is inside the food we eat can mineralize it, and then it will form what we call calculus. And that calculus is usually like all these whitish flakes that you see on the surface of the tooth, usually on the inner aspect of the lower teeth. Those things, I mean, the calculus you cannot remove by yourself, no matter how hard you try. So when you go around, just look at people's teeth when they smile, especially the anterior teeth, you may be able to see some of these things. I mean, you have some stains that we also need to professionally clean for you. So we expect you to come. If anything also is beginning to develop, maybe you have, some people even have, carious tooth, cavities in their teeth, and because it hasn't given them pain, they say that I'm fine, there's nothing wrong with me. Whereas there's a cavity that is becoming deeper and deeper, such that there are times that that tooth is almost completely broken down in the mouth. You can't even restore that tooth again sometimes by the time people come. So that is why it is so important for you. Just go and visit your dentist. Say, I've come to see you again today. We look in your mouth and we recommend whatever we think you should do.
Wow, thank you so much. You just answered the question of the person that sent a question that I don't have any problem with my teeth and I follow strict dental hygiene recommendations. Why do I need to visit a dentist? So you've heard that from Dr. Tunrayo. You need to visit a dentist, if not for anything, for prophylaxis. You know, most infections and diseases of the mouth and teeth are preventable and are also, can be treated if caught early on time. Like she said, you might even have cavities on your tooth without even knowing it. But when you get to see a dentist, they will be able to examine and determine it early and your tooth can be restored. So thank you very much for that. Now you mentioned something. I know some of us will not be happy about what you just said. About bone crushing. Some of us love bone crushing, especially most people that comes from Africa You know, we don't just eat our chicken and leave our bone. Oh my God, you're wasting resources. You have to eat your chicken and crush your bone. And even growing up, they told us it is good to crush our bone. That is good for the health of our teeth. What do you have to say?
Yeah, basically because of the calcium that is present inside, basically because of that. But of course, if you need to chew bone, you do it cautiously. And it should be maybe something like brisket bone and the chicken bone, which is soft enough for you to crush. But you have to also be careful so that you don't fracture your tooth or your tooth chips off in the process of doing it. Everything in moderation.
Okay, that's good. Thank you. So we can go ahead crushing our bones. Just do it with caution. Thank you so much for that. That's really helpful. Somebody sent a question. He said, I live in Ogun State, Nigeria, and I need to go for dental services. Do you have recommendations?
Okay. For the person that lives in Ogun State, I am aware that there's a dental center or unit in the Federal Medical Center, Abeokuta. I am not certain that the general hospitals in Ogun State have dental units, but I'm very sure that the person can walk into the Federal Medical Center to be attended to. There's also a possibility that the university, which is the OOU, may have a dental unit. I think that that possibility is there. If the person also is close to Babcock University, that's an Elishan, Iremo, I know that they have a vibrant dental unit because I know of a colleague who heads the unit currently.
Wow, thank you very much. So talking about recommendations, just know that wherever you are, this person that sent you the question is from Ogun State, Nigeria. But wherever you are, if you don't have a personal or family dentist, you can walk into your family physician, you can walk into your primary care unit, you can walk into a nearby clinic and tell them, and they will be able to recommend and direct you to appropriate dental hospital. Yeah, so please, thank you very much for that. Now let's go for the next question. You know, there is something that can be so most embarrassing, and that is bad breath. Bad breath, it is really very embarrassing. And it is more embarrassing because sometimes you have bad breath, you don't even know you have it. And it's not only embarrassing for the person that has the bad breath, it is also embarrassing for the person that is standing beside the one that has the bad breath. You might not have the bad breath, but somebody is beside you and has bad breath. So you are caught in between, like, should I tell her? Should I not? Should I just let it slide? Will I cause more trouble telling her? How do you tell somebody, excuse me, ma'am, your breath stinks? Or how do you say it? I mean, there are good ways you can say it, but it could be so, embarrassing, and you can feel timid to say it. Now, so we've seen so many people have bad breath, all around us. What are the causes of bad breath?
Okay, thank you. So, well, going to the first part where we were saying how you can tell them. Usually, I think it's people closest to them who can tell them. I mean, if you are in a random bus or train or whatever, I'm not sure that you'll be able to walk up to somebody and say that without, causing a scene and all that. But if, for example, you have bubble gum, sugarless gum, or whatever, you can offer them. That may send a message, or you can look around them, someone who seems to be closer to them or they are speaking with, you can just chip that thing. But that being said, it's usually people closest to someone who can say, oh, they have a bad breath, somehow validating it. Now, what are the causes? The main job causes are when your mouth is dry. And usually this happens, it can be for people, for what we call the morning breath, the one you have when you wake up in the morning. Because of course, at the time you are asleep, saliva production and flow is actually reduced. So because of that, your mouth is dry, and then the bacteria are having a field day. Usually it's all these sulfur producing bacteria that you find on the tongue and the throats that are responsible for that. But your dry mouth is a major cause because saliva is not flowing well enough to be able to wash it away. So whether, I mean, you're just waking up in the morning, you have what we call the morning breath, or you have slept any time during the day, there's reduction in saliva flow, and so your mouth will swell. There are some people that also have a condition that we call dry mouth or xerostomia. I mean, this is common now with people as they increase in age, although you may also find it in a number of age groups because of some genetic defects that they have. So their mouth is dry. So in that case, of course, they tend to have what? Bad breath. Some of the times it may be the kind of foods we eat. People that take beans, those of us from Africa, I mean, you take a lot of beans, or sometimes it is egg, or maybe it's even the low-cost beans, the one we call iru, that can really smell a lot. So those ones, by the time you consume the food, of course, when you breathe in or out or you speak, some of those, smells can actually come out. So the foods we eat is also an indication, it's also a cause for what we call halitosis or bad breath or mouth odor. There are times that it's also an indication of some diseases taking place inside the body. Sometimes if you have sinusitis, for example, those people that their noses are always blocked, they are not likely to know that they have mouth odor. For people like that, that their noses are blocked, people that have sinusitis, people that have bronchitis, upper and lower respiratory tract infections generally, because of the possibility that your nose may be blocked, you can't smell properly, your mouth can actually smell. Some people that also have some other issues with gastrointestinal diseases, for example, or even sometimes some cancers. There are people also who have chronic illnesses like a chronic renal disease. They have what we call uremic breath. So all those things can actually contribute to you having mouth odor, or what we call halitosis. And of course, there's yet another group that we say they have what we call the psychogenic halitosis or pseudo halitosis, in the sense that this person comes to the dentist and says that, oh no, I have mouth odor, and you have examined, you can't perceive anything. Sometimes we even use what we call the alimeter, and there's no significant reading on it. Yes, the person believes that they have mouth odor. You also ask other people to come, other professional dentists around you to see, so that of course we can have 2 or 3 witnesses looking at this thing, and still the person believes that they have mouth odor. So of course, for such people, what you want to do is to be able to counsel them, offer them oral prophylaxis, and sometimes you may ask them to actually see their psychiatrist for people in that category.
That is so enlightening. Thank you for letting us know that. So Dr. Tunrayo has been able to kind of break it down into 3 different subgroups. So there are some that is just because of what's going on, like what did you eat, or you have your mouth is dry, or you're just waking up in the morning and you have this bad breath from your mouth. And he also said that it can also, the second category is that it can be as a result of an underlying disease. If you find out that when you go out to see your physician, they usually, check your mouth. In fact, there are some bad breath that will come in that merely walking through the person, you can perceive it and you can make the diagnosis right away. You can know that, oh, this person is having ketoacidosis. There is most likely is diabetic, and all that. You can, from the smell that is coming from the mouth of the patient, you can almost come to a conclusion of what's going on before you examine the person. So that's the second category, those that have underlying disease. And he said one that is very interesting. You think you're having it, but you don't have it. So yeah, so if you think you're having it and you're worried, it's good to still, consult with your dentist, but the dentist will be able to let you know that, oh, this is psychogenic. You don't actually really have it. And they'll be able to refer you if needed. So those are the three basic causes, basic category of causes of halitosis, otherwise known as bad breath. So thank you for explaining that. And when you talk about food and you mentioned Iru, I was just, giggling within me because I had an experience with that. Iru is a very, very, very delicious compliment from Yoruba aspect of Nigeria, but it stinks a little bit too. But there was a time I made a food with Iru and I took it to work. And of course, you know what happens. So yeah, so that's very good for us to know that if you take some particular form of food like beans and everything, just know that they are likely to affect your breath, and make sure you do something after eating it. You can brush or rinse your mouth and all that. I think Dr. Tunrayo will talk to us about that shortly. So now somebody said, I relocated from one location to another location. It said, before I moved, I wasn't having bad breath. I started having bad breath when I got to my new location. So will you say that bad breath or halitosis is environmental?
Okay, thank you. Halitosis is not known to be environmental. What may have happened, maybe one or two, maybe either that the person's diet recently, I mean, uh, because some people also that take garlic also, they also exude that garlicky smell actually. So maybe a thing with diet, maybe a thing that the person may have sinusitis or some other respiratory tract infections that has just developed. The person may also be having dry mouth that they didn't have before, that just developed, maybe a situation of the dry mouth, or it may even be psychogenic. So my recommendation to that person would be to see the dentist. When you see your dentist, the dentist is able to eliminate whatever causes are not present and be able to calm down and say, okay, this is the reason for your halitosis, but it's definitely not environmental.
Thank you very much. Now, my father used to have bad breath, and now I'm having it too. Is it familiar? Does it run in the family?
Okay, thank you. Halitosis or bad breath also does not run in families, is not familiar. There's no heredity about it. I think that, just as I mentioned for the person that moved from one location to the other, that is also, that response is also what would suffice for this person. Either that something has changed in your diet or your mouth has suddenly become dry. Because the dry mouth that we're talking about, like I said, is an age change. For people that grow old, when you start reaching your sixth and seventh decades, there's a high chance that you may experience some form of dryness of your mouth. Some people, the medications that they are taking, including antihypertensives and antipsychotics and all of some of those, a lot of those drugs can actually make your mouth dry. For example, if you take the regular chlorpheniramine, you find out that actually it dries your mouth. So medications can make your mouth dry. The aging process can make your mouth dry. And maybe as a result of some diseases, there are people that have issues with their salivary glands. Maybe for any reason, they had any disease that required them to undergo a measure of irradiation. So some of those glands were irradiated and so are not functioning at their full capacity. So it may be any of those things. And like I said, your dentist is the one to, be able to, that will pinpoint what the exact cause of the bad breath is in this case. But it's definitely not familiar.
Thank you very much. So what I hear you say is that halitosis in itself is not familiar, but you might be exposed to the same thing your father was exposed to. You might be using a form of medication, and it might be growth that now you're growing up, your hormonal changes comes in, and then you have dry mouth, or you're using a particular medication, or probably maybe your dad has hypertension, you have hypertension, is using the same medication that you're using. So in itself, it's not familiar, but it may be, exposing yourself to whatever your father exposed himself to. And he said, and Dr. Tunrayo said, you should visit your dentist if you have concern. Now, you've been saying visit your dentist, visit your dentist. That takes me to my next question. Does it have a cure? I mean, that's what somebody was asking. Does bad breath have a cure? If I go to visit my dentist and he's saying, hey, this is the reason why you're having it, is there a treatment?
Yeah, thank you. Of course, there are treatments, and the treatments that you require will depend on the cost. For example, for people that the issue is dryness of mouth, dryness of mouth your morning breath, for example, or you slept anytime during the day and you woke up, you have bad breath. Of course, the answer to that is to brush your teeth. Now, for people that, for example, you may even have a cavity that you are not aware of because it's not giving you any pain or any other symptom, that will require you going to restore that tooth, if that tooth can still be restored. But what I'm saying is that if there's a problem with your tooth or teeth, we have to fix that problem. When we fix that problem, more often than not, the halitosis goes away. If, for example, you also, in case of people that you have food particles and residues hanging on your teeth and all that, and you also do not floss, we will require that your toothbrushing is now at least twice in the day, the first thing when you wake up in the morning and the last thing when you are going to bed at night. Because what you find out is that if, for example, you have a cavity anywhere, food will pack inside and the bacteria, they will go ahead and do their job. So in that case, that means you may need to floss, you may need to also brush your teeth at night. For those who have dryness of mouth, of course, we would advise that you take frequent sips of water. So that means you must have your bottle of water with you almost anywhere and everywhere you go. You know that even for people that fast, if you are fasting throughout the day, usually, when you speak with people, your mouth tends to smell after some time. So we would recommend that you do frequent sips of water. Would recommend that you take sugarless gum. What the sugarless gum does when you chew is that it will stimulate the flow of saliva. So saliva is able to cleanse your mouth of some food debris, cleanse your mouth of some bacteria and all of that. So when you take the gum, it helps to stimulate salivary flow. For those who, for any reason, there's any problem, the dryness of mouth is as a result of this xerostomia that we have mentioned. And remember that we mentioned that some medications, such as your antihypertensives, antipsychotics, may actually dry your mouth. Then, we know that for antihypertensives and the antipsychotics, they are drugs that you have to take over a long period. So in that case, because we know that you need to treat whatever situation warranted these medications, in that case, then you will need to be taking your frequent sips of water and and chewing your gum so that saliva flows. But for people that have xerostomia, that also have that xerostomia, that is as a result of maybe degeneration of their salivary glands. So the salivary glands is not producing as much. In that case, we recommend some things that we call sialogogues. That's what they do is that they try to simulate the production of saliva. But of course, the sialogogues have to be prescribed by the dentist. It's not an over-the-counter thing. So usually when you take all these measures, to attack the cause of the bad breath, more often than not, you would, be cured of it, so to speak. And don't forget that we mentioned psychogenic halitosis, where we said that your dentist sees you, we offer you oral prophylaxis, but at the same time, in some cases, we may need to refer the person to see the psychiatrist. So
thank you very much. That's so very helpful. Now, I'm sure one or two people listening to this will testify. Maybe they've ever had a toothache before in their lifetime. I have had more than once. And the ache of a toothache is indescribable. You know, you will agree with me that I don't even know how to put it. The pain of a toothache is a painful pain. You know, it goes, you know, right to your brain when it comes in. So, you know, some people even try to equate it or even sometimes rate it higher than the pain of a child labor, like when you're going to, you know, give birth. That's how much. When you ask some people on a scale of 1 to 10, how will you rate your skill? Some people will just tell you, well, maybe it's 15 or 20. I don't know what scale you're using. So we know it is very, 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 very painful. Now let's talk about toothache. What are the causes of toothache?
Okay, so the causes of toothache, of course, whatever affects the tooth can actually give you toothache. So your toothache may be as a result of cavities, like we have said, especially when it has gone beyond the enamel, beyond the dentin, and it has entered the pulp. So once the pulp becomes inflamed, you have what we call pulpitis. So you will have pain, and it can really be excruciating, especially when the pressure has built up inside the tooth and it cannot escape. You find out that some people have what we call abscesses in their mouths. So when the abscess begins to discharge, their pain goes off and they are fine. But when that thing is still there, the pressure has built up, that's when you have pain. Sometimes without the abscess, you have the pain. Sometimes it may also be as a result of issues with your periodontium. The periodontium, as I said, is the supporting structure of the tooth, and you have the gum, and then you have the periodontal ligaments, and then you have the alveolar bone, which is what our teeth are attached to. So if there's any problem with any of those parts that we have listed, you know, if your gums are inflamed, sometimes your there's what we also call periodontitis. When it has gone, the inflammation has gone beyond the gum. It has now also affected the periodontal ligament fibers. We'll say that what you have is periodontitis. In that case, because the periodontal ligament fibers are like a meshwork that anchor the tooth or the teeth to the alveolar bone. Sometimes when you have issues with it, you may find out that your tooth becomes loose. It begins to shake a bit here and there. And if you are not careful, you may actually fall off, or you may even present yourself at a dental facility, let me call it that, and they may extract it without investigation. But like I said, when there's an inflammation of your pulp, you will have toothache. When there's a problem with the teeth supporting structure or periodontium, you have pain. I mean, like I've mentioned earlier, people that use their teeth, they are used to opening corkscrews with their teeth. And of course, because they've done it many times, they think that there's nothing to it. But what you find out is that you begin to weaken your, tooth or teeth little by little. Sometimes you may have part of that tooth chip off without you knowing. And if it chips off without you knowing, the fluids from our food, of course, they have both hydrogen ions and whatever. And because of that interaction, you may actually have pain to your teeth. There are times that, there are lesions, growths in the teeth also that may cause pain. Maybe, there's a swelling, like that abscess that we said, it can really, give you very horrible pain that when you say on a scale of 1 to 10, you almost put it at 10. So all these things can cause toothache.
Thank you very much. And that's so helpful. And that's sort of answered the question of the person that said, I have a hole in my tooth. What should I do? What you should do is to visit your dentist, because if you're still comfortable lying down and typing that question to me, most likely the hole in your tooth is at the level of the enamel. Dr. Tunrayo just told us that it could be at the level of the enamel, it can extend to the dentin and to the pulp. By the time it extends to the pulp and it gets all the blood vessels involved, my dear, you'll be feeling that pain in your head. And then you'll be rating it at the level of 8 or 10 or even more. So if you think you're having a hole in your tooth, please visit your dentist, and the dentist will be able to examine it and prescribe appropriate
Treatments.
to use at that time. I'm sure that there are, diverse. What are the things that you can help to treat, or procedure that you have for anyone that has hole in the teeth?
Okay, like I said, if it's still at the level of enamel or dentin, of course we can restore using amalgam or using the composites. The composite is the tooth-colored restorative material that we can use to plug up a hole. But like I said, if it's still at enamel level or dentin, is fine. We can do that. But once it gets into the pulp, we have to do what we call the root canal therapy. The root canal therapy, which will now require that when we are done, because the tooth has been weakened by the drilling that we have to do, we have to cap it with what we call a crown. So those are the treatments that we can give for when you have cavities in your teeth.
Thank you very much. And that answers the question of the person that asked a question about crowning. Thank you for that explanation. Now, everyone wants white teeth. Everyone wants a bright smile and good dentures. I usually really like to see people with good dentures and white teeth. You agree that it's easier to smile and to say cheese when you have good dentures and white teeth. Okay, so the topic of today is like preserving your smile. I see that topic in two ways. Where preserving your smile, like your dentures, we still want your dentures to be there so that you have confidence to speak and to smile. And also we're preserving, dental health is preserving your smile in a way that you don't have pain. That person that is rating the pain at a 10 out of 10, I'm sure she will not be smiling at that point. So we want to preserve your smile. We don't want you to be in pain, and we don't want you to be depressed, and we don't want your smile to be dimmed. Now, talking about white teeth. Somebody says, my teeth are not white. And despite the fact that I do regular dental care, are my teeth unhealthy? Does it mean that I have unhealthy teeth?
Okay, thank you. The person that wrote the question is not likely that you have unhealthy teeth, because the things that determine the color of your teeth or the color of your dentition isn't just about the teeth themselves. Things like the color of your sclera, that white part of your eye, even the color of your hair, the color of your skin, they all, join together to give the color of your teeth. So what we find out is that, for people that are dark skinned, the ones that in Yoruba we will say they are adumadon, or that the ones that you see they are ebony, you find out that they seem to have whiter teeth. Why? Because of the contrast of that their skin with the teeth. So the teeth tend to look whiter because of that contrast that you have between a very dark skin and the teeth. Whereas people that are a bit fairer, fair in complexion, your teeth does not seem to look as white because of the color of your skin. The amount of contrast you have is less compared to the people that are really dark. So when you just look around you, you observe that people that are much darker tend to have whiter teeth. But that's notwithstanding, we are expected to, brush our teeth with fluoridated toothpaste at least twice in a day, first thing in the morning and late at night. Now, there may also be other reasons why your teeth are not as white as you think. There are, there's what we call tooth staining. Staining of the teeth may be as a result of the kinds of foods you eat. You know that if you take any of these orange drinks, Fanta, Mirinda, and things like that, you will see that it coats your tongue temporarily. So that kind of thing also happens with the food we eat. they may actually stain our teeth and give it color. If you eat beans, for example, sometimes you will see that the skin of the beans has, taking residence on the surface of your tooth or teeth. But and then for staining, that's the type I've just described is the one we call extrinsic, outside the substance of the tooth. For people, some other people, what they have may actually be intrinsic staining. That staining affected the substance of their teeth. So now, those ones are the ones that tend to look a bit grayish to brownish, and those ones will usually be that they have an intrinsic stain. Maybe as a child, your mother, had given you tetracycline when you were, say, less than about 6 to 10, or even while she was pregnant with you, she took that tetracycline. In fact, the more common thing is that a pregnant woman took tetracycline during the pregnancy. Usually the child will come down with the grayish to brownish teeth. So those ones are intrinsic staining. Intrinsic staining. There may also be some other defects that affected the substance of the tooth, things like amelogenesis imperfecta or dentinogenesis imperfecta, or even things like enamel hypoplasia. All those things that now affected the substance of the tooth because of some genetic events while your mother was pregnant with you or that happened at birth would also now give you that intrinsic coloration. So those ones, the intrinsic coloration, your toothbrushing is not going to do much for you really, unlike the extrinsic stain that is just external. You can brush it away with proper toothbrushing, or even sometimes the scaling and polishing that we have mentioned. But for the intrinsic staining, you definitely need dental intervention to sort that out. And the staining may also be as a result of age. When people become older, they tend to have yellower teeth because what you find out is that in the course of their lifetime, their teeth have been subject to all kinds of things, and the enamel has worn away slowly. So in that case, their teeth tend to be yellow. So either because of age or because of intrinsic staining that your toothbrushing can do nothing about, or occasionally because of extrinsic staining that your toothbrushing and the oral prophylaxis can take care of.
Wow, thank you very much. Wow, you've gone extensively on that. And it's a learning curve for me to know that, the color of your teeth can be dependent on the color of your hair, the color of your sclera, and the color of your skin. I know these are hereditary traits. So that means if the color of your teeth can be dependent on that, so the color of your teeth is also a hereditary, in that essence. So now you talked about intrinsic and you talked about extrinsic, and you also talked about pregnant women using some medication. For instance, you mentioned tetracycline. I know this is common in Nigeria. Self-medication, people walk into the chemist and get themselves tetracycline and use while they're pregnant. So this is something for us to go home with. If you're pregnant, you should consult your medical doctor for advice on what medication you should take, because tetracycline, for instance, can stain the teeth of your unborn child before it's even born. So there's a lot of causes that you've highlighted here that we really need to make aware of. But one thing I want to say here is that even though it is possible for you to have hygienic issue with the color of your teeth, like if you don't brush your teeth, regularly, your teeth can be discolored. It can also be something that, it doesn't have anything to do with hygiene. So you might have set of teeth that is not too white, and that does not mean that the teeth are unhealthy. So don't let anything dim your smile. Do not be depressed about something that you don't have anything to do about, basically. And if you're too bothered about it, please visit your dentist. I'm sure there is something that can be recommended. Now, talking about recommendation, do you recommend teeth whitening?
Okay, yes, teeth whitening will be required for, of course, people that have intrinsic staining. But of course, it would also, I mean, depend on their age. I mean, if you see a 70-year-old man or woman that has extremely white teeth, everybody knows that Baba has a dog bossy, or has, that kind of a thing,
Yes.
really. Uh-huh. But of course, most a number of toothpastes now have the whitening type. I know that most of the common on the shelf toothpaste, they have whitening types of their toothpaste. They will say tooth whitening. You will see results in 14 days and all that. The person might start with that. Of course, most dental services will offer you the opportunity to whiten your tooth, or sorry, to whiten your teeth actually. I mean, those services are rendered in the dental hospital. I'm sure that you will be told the pros and the cons of doing that. Of course, basically what is being used is to use hydrogen peroxide. Some people also say that in the house you can use a banana peel or orange peel or lemon peel and all that because of some of the things that they contain. But you can also visit your dentist for the whitening. It's just that, I mean, once you start to do whitening, tooth whitening procedure, it's not as if you have a procedure now, it will last forever. You may need to keep retouching that procedure because after a while, the residues from your food would also attach themselves over the surface of your teeth over a period of, say, maybe 2 to 3 years, and then you will need another visit so that you don't think that once you whiten once and for all, no, you may need to keep going back. But if you want to start, I would recommend get the tooth whitening toothpaste. I'm sure that there are a lot of them on the shelves nowadays. Do that and see, especially the ones that tell you that you can see your results in 14 days, and then you can proceed to your dentist after that for the office tooth whitening or bleaching.
Thank you very much. Some of us have extra teeth, in our mouth. What do you think should be done? Is braces recommended?
Well, the issue of braces actually is to be able to rearrange your teeth. You find out that some people have maybe for any reason, their milk or primary teeth refused to fall off. And then, of course, now you have the permanent tooth growing maybe behind those ones, and the milk teeth have still refused to fall off. In that case, because the space occupied by your milk tooth is smaller than, and your permanent tooth, of course, is definitely bigger, so you find out that the arch, as we call it, that arch where your teeth are arranged is small. So those big teeth cannot, I mean, stay there. So we will need to do some form of arch expansion for you. And then you may need to use braces to rearrange the teeth. But if you have extra teeth, of course, the first thing will be to present at your dentist, where we will take the orthopantomogram. The orthopantomogram or the panoramic radiograph shows your teeth, both upper and lower jaws on both sides at the same time, so that we can see, do you actually have the normal complement of teeth that you're supposed to have? As an adult, you're supposed to have a complement of 32 teeth. By the time you are at least 18 to 21, we expect you to have 32 teeth. So we check, do you have the normal complement of teeth in your mouth? Now we now look at that extra tooth. Of course, the tendency is that when you have an extra tooth somewhere where it's not supposed to be, because usually extra tooth, they are not usually on the arc, but a particular one that we call a distal molar will now go and stay at the back of your tooth number 8, or the one we call the third molar. That one is the other one that can stay on the arch. Or sometimes when you have what we call a mesiodens, a mesiodens is the one that stays between your central incisors in the front. So what they do is that because they are positioned where they are not supposed to be, food will tend to be hiding in those places where you have those extra teeth. So because of the fact that food will pack there, and then of course it will cause some measure of inflammation and pain for you, and then we will want to extract it. But we would also want to check, first of all, as I said, to be sure that you have your full complement of teeth, and then we can decide that, oh, okay, we're going to extract this thing. One, because it may, for those of them that will stand beside any of your molars on the side of the cheek, we call them paramolars. That one can be tearing your cheek inside. So that is already disturbing you. We would have to extract it. Food may be packing in other areas. There may even be a hole on the tooth that is standing normally, that extra tooth has gone to visit. There may be there. So we really want to prevent that. So
Yeah.
we would need to extract it after we have checked that you have a full complement of the teeth that you're supposed to have in your mouth.
Thank you very much. So if you're having extra teeth in your mouth, visit your dentist. Now, let's talk about gap tooth. Growing up, gap tooth is like an in thing. Everybody wants. I wanted gap tooth at a time. We call those people that have gap tooth a G, because gap tooth is called a G. Yeah, in Nigeria. So what do you have to say about gap tooth? Is it an effect, something you can use for fashion, or is it a defect?
I think that it can be both. I mean, for a long time, especially with us in Nigeria, we had associated it with beauty. The people that have these AGs, as we call them, they usually look more beautiful to us. I think that even in my own family, maybe I'm the only one that doesn't have. My sisters also
Oh.
have the AGs. Yeah. But the thing with it is that depending on the size, there are times that, I mean, the AG can be so wide that if you put another incisor there in the front, it will stay easily. So
Wow.
if the person that has it is concerned that the space is so wide, and the dentist, I mean, has looked at it and thinks that, okay, even when we put another tooth there, I mean, it will still fit. We may decide to do that if that is what the patient has. But if the width is not, I mean, so big, if it's less than maybe a quarter or a third of the size of the central incisors, we might leave it. The other thing that can be done is to move the teeth orthodontically, but that would be in extreme cases. Otherwise, just keep looking beautiful with your age.
That's nice. So if you have gap tooth, keep looking beautiful. If it doesn't bother you, just make it into a fashion state and enjoy it. Now, a question came, says, is it safe for children to visit a dentist? My baby of 1 year and 4 months has a hole in her tooth. Is it safe to visit a dentist? And what age should a child start visiting dentist?
Okay, thank you. It's safe for your child to visit the dentist. We don't harm, we don't bite. And the age at which would expect your child to visit dentist, we expect that by the time the first tooth shows in the mouth, usually that's lower central incisor, we want you to bring your child to the dentist. And there are reasons why we want to do that. Number one, we want to be able to introduce the child to what we do early. We want to desensitize that child, because the mythology is that, oh, if you go to a dentist, the dentist will cause you pain. The dentist don't cause you pain. The dentist take your pain, your toothache, and tooth pain. We take it away. We don't cause pain. So we want to be able to desensitize that child. We want that child to be used to us. And then we know that with children, there are a lot of issues with their, I mean, the erupting teeth. There are times as a child, for example, your child is 8 months and doesn't bring out any tooth at all. I mean, so for that reason, we may need you to show up so that we take a periapical radiograph and see, to be just confirm that, okay, that tooth is there and is beginning to come up, and then it will show. Of course, some children are early erupters. By the age of 4 months, they already have 2 or 3 teeth, whereas some people are late erupters. I think my first son didn't have his first tooth until maybe it was 11 months. And
Wow.
I really got, I was a bit agitated. I was wondering if
Oh, so a dentist can be agitated, right? You
I,
were a mother at that point, not a dentist.
yes, I was a mother at that point. And of course, I was wondering, oh, is it because I'd extracted other people's teeth and, things like that? So some
Yeah.
children can really be late erupters. You want to be sure that that tooth is present, because there are times that some teeth may be absent. They are not there in bone. So because of problems like that, and if a child erupted, in fact, there are children that are born with teeth in their mouth. We call those teeth natal teeth. And because of our environment, people think that those children are abnormal and all that. Some of them, if you are not careful, may actually, you know, end the child's life and all that. Meanwhile, there's really
Mm,
nothing wrong with it. I mean, the percentage of people that have natal teeth is very extremely small, but we see it. So that's why, because of there are issues that are associated with teething and all that. People think that when a child is teething, the child will have diarrhea, will have
mm,
such fever. But what our recommendation is that usually once the fever is greater than 1 degree above the normal body temperature, it is no longer teething. Teething is not associated with the child having diarrhea. The
mm.
child will have some gastrointestinal infection. So it is not the issue of the teeth. So all these things we're able to educate the mother. So that's why we want you to come in. First, the time you notice the first tooth in your child's mouth, bring the child to see the pediatric dentist, because the pediatric dentist see children from the age of 0 to less than 16. So we're able to counsel you, educate you about things that the child
Mm.
should eat and not eat vis-a-vis their oral health. And of course, dismiss some of this mythology. A lot of people use teething powder, which is definitely injurious to the child. We do not recommend the use of teething powder for a child that is teething, because teething is just a normal physiological process that you don't really need any intervention for. But if a child begins to have fever, definitely you want to bring, so that we are sure that, oh, this fever is not as a result of malaria or any other disease process. When the child begins to stool, we want to be sure that, we are certain that it has nothing to do with the teething. So you want to be able to take care of the child, so that, of course, the child does not get dehydrated and go into shock and all the other sequelae.
Wow, I'm glad you talked about teething in children, because that has been an issue in the past. I remember growing up, we talk about this Ashton and passing a ọmọdé or something. So at that time, if you're a mother, you must have packs and packs of Ashton and passing medication in your house. And once the child is having fever or diarrhea, they associate it with teething period. So I'm thankful that you're able to make a clarification on that. If your child is having diarrhea, go and check with the medical or the pediatrician to, take care of the diarrhea. It's not associated with the teething. Thank you very much for that. That's really helpful. So now, is it safe for a pregnant woman to have dental procedures?
Yes and no. No, because usually the pregnant woman will not get any treatment in your first and second trimester. What we would do normally when you present at the dental hospital is that we would examine you, and then we will determine what treatments we want to give you. But in this case, we won't do any operative procedure, no extraction, and we are not likely to also fill your tooth for you at that time. What we will do is to be able to give you the medications that are appropriate for your gestational age. Why do we avoid the first trimester, treating during the first trimester? We know that organogenesis is taking place during that first trimester. We don't want to subject you to anything that would disturb that, because some of our procedures, you sit on our dental chair and then the chair is moving up and down. And then sometimes we extend, the headrest. We put you in postures that, those kind of postures that you may have to assume when we are feeling your tooth, especially. We don't want to, we don't want to stress you or stress the baby. And especially because organogenesis is taking place in that first trimester, we don't want anything that will disturb that. Even in the second trimester, depending on how healthy the pregnant woman is, for some of us, our experiences, maybe it was at the end of the second trimester that you really got yourself together. Also, we don't want to do any intervention at that time. If you have a toothache, we will palliate it until, say, you are in your third trimester. And even at the third trimester, it must be an extreme emergency for us to extract your tooth or something. We will usually palliate you until you deliver. Once you deliver your baby, oh, mine, you can show up by, say, the next week or 2 weeks after delivery, and we can carry out whatever treatments you want to carry out, because our concern is the safety of the mother and the child, which we think that we may disturb physiologically and physically with our treatments.
Thank you for that. The next question is, my teeth are weak and my gum are eating up. How do I recover them back?
Okay, for somebody that has brittle teeth, what it suggests is that there is, how do I describe it now? There is something definitely going on with your tooth, and it may be something that is genetic actually, because we don't expect your teeth to be brittle normally. Otherwise, we won't be able to drill it and put a restoration on it actually. So we would expect you to come see the dentist for your gum that you think is eating up. One, I want to find out what your age is. If you are in the age category of 55 and above, I expect a measure of recession of your gingiva. At least your gingiva will be moving up, and I'll be seeing it. I'll be able to see part of the roots of your tooth. Is a normal age change. If you are 55 and above, I expect to see that, and I'm not afraid. But the other thing may be to find out if you have a measure of gingival infection or inflammation, which we'll be able to determine when we examine you. Then the other thing may be that you actually have a problem with your gum and the periodontium. The periodontium refers to the totality of the tooth supporting structure, starting with the gum to the periodontal ligaments, which we can't see, that is inside, that I described earlier, that is like a meshwork of fibers that anchor your teeth to your bone. So when there's a problem with the gum, that's periodontal ligaments, and even with your alveolar bone, yes, your gum may begin to behave like that. So in that case, we also need to be able to examine you and see, because some people have what we call this aggressive juvenile periodontitis that affects the tooth supporting structure of periodontium, and you begin to see that their gums begin to recede. And in this case, some of those teeth can actually become loose, shaking, mobile, and then they begin to fall off one after the other. But sometimes when you see that the tooth is shaking, they just present as a roadside dental place and have those teeth extracted until most of the teeth in their mouths are gone. So the person may actually have what we call a juvenile aggressive periodontitis, for which you need to seek dental intervention as soon as possible.
Wow, thank you so much. Wow, we've been able to treat a lot of topics within today. We're a little bit beyond schedule, but I believe that you've all been able to receive answer, at least to an extent, to all the questions that was sent in. If there are some other follow-up questions that you have, please feel free to send us an email or send the question to us inbox at Tribe O'Clock on Facebook, and we will get those questions answered. I will hold Dr. Tunrayo Adesina accountable to answer all our questions, on dental and oral health. So it is very, very important that we take a hold of that. And I want to say thank you so much for being part of this discussion this afternoon. And thank you for others that will be listening. after today. I hope you find this presentation useful for the health of your teeth and mouth, and that of your children and family as well. Tunrayo, I just want to say thank you. I was able to drag you out. I know I dragged you out. I don't want to say more about that. To be able to do this today, I want to say thank you very much for your time.
It's my pleasure. I've enjoyed every bit of it. Thank you for having me. And then to the audience listening, thank you also for listening.
Thank you so much. So this, we call it a wrap up at this time. This is the end of today's episode of Tribe O'Clock Health Talk. I hope you join us again, same place next month for the next month's episode of Tribe O'Clock. The details of that will be posted on our page on Tribe O'Clock. Please like and share if this has been a blessing to you, and let us together join hands to thrive and to, prosper in health and in everything that pertains to life. Till next time, I'll say to you, keep being good and keep your teeth healthy. Thank you so much. Bye-bye.
Bye.